Thanks for staying with the Monday Report. Now, faith-based hospitals have expressed concern with the proposed Health Amendment Bill 2025. They say that the bill, which criminalizes the detention of patients and bodies by hospitals, is punitive and one that will cripple operations in the private health facilities. But as Mary Mwoki reports, the sponsor of the bill, Kirinyaga Woman Representative Njeri Maina, insists that the bill seeks to guarantee quality health care for the vulnerable.
The Health Amendment Bill 2024, sponsored by Kirinyaga Woman Representative, has kicked off a storm among healthcare providers in the country who raise concern that the bill is punitive and will affect the operations of the facilities. The proposed law criminalizes the detention of patients and bodies in public hospitals over unpaid bills. Section 3, subsection 4 and subsection 5 bars public health facilities from demanding deposits prior to providing emergency medical care and also criminalizes the detention of bodies while setting stiff fines for those convicted. Faith-based hospitals term these clauses unfair, leaving them with no recourse for reimbursement by the exchequer, unlike public facilities.
Patients will be coming. They can't pay out of pocket. You can't retain them. Then we will be faced with what we call a moral hazard. We risk that, moral hazard, whereby people will take advantage of the existing, measure. People will not enroll into the social health insurance with the knowledge that they'll just come, they get the services, and then they don't pay.
The proponent of the bill, Kirinyaga Woman Rep Njeri Maina, maintains the bill was necessary to cushion vulnerable Kenyans.
The hospital facilities just take advantage of the emotional turmoil and the African custom to lay our kin to rest and to find closure by interning their remains. But then dead body will never become property. It cannot be sold for profit.
For one patient that you are retaining or detaining, for that matter, you pay up to 2 million. That will kill all the hospitals in our ecosystem, within our actually FBO fraternity. You just need to have a number of them and they will not be there.
Maina insists the bill excludes private facilities and will only apply to public facilities, even though its wording targets all healthcare providers. Section 7, subsection 3 states that any medical institution that fails to provide emergency medical care commits an offence and is liable to a fine not exceeding 3 million shillings.
So you cannot assume that and have more or less government-leaning provisions without considering how it will affect the private sector. And this particular bill, to a good extent, it affects FBOs, it affects the pure private facilities much more than the government facilities that at least have some funding from the exchequer.
Private hospitals are jittery about the bill due to concerns over their financial viability and operational autonomy stemming from mandatory service provisions without guaranteed timely reimbursement and punitive measures. Mary Mwoki, Citizen TV.